So, what language should you use when talking about disability? That's what I want to talk about today. So, there are two main ways of talking about disability. You can use person first language, or you can use identity first language. Person first language is the one that everybody is already familiar with. It's the one that is most commonly used, medical professionals use it, most people use it, and it goes something like this. He is a person with autism. She is a person with Down syndrome. It's always person with, and the reason behind that is because the people who use it believe that you should put the person before the diagnosis. The person is the most important thing in that sentence, and so when you're talking about them, you should put them above anything else because their disability does not define them. So it's always the person. The other way of speaking about disability is identity first, and it would be something along the lines of saying autistic person, depressed person, OCD person, OCD woman, whatever. It sounds a little weird because not all of the diagnostic labels really work when you try and make it into like an adjective like autistic, the same way that you might say red-headed or white-skinned or tall. All of these descriptive words work for grammatical reasons. And so there are some terms that really do lend themselves to identity first, autistic being a perfect example, or blind or deaf or something that works well as a descriptor. Other ones are more like nouns, naming words, cat, dog, person, woman, glasses, OCD, So it does sound a little bit weird. But people who use identity first language, they really believe that the reason that they're doing this is that just because it's a part of their identity doesn't mean that's all of who they are, and claiming it or reclaiming it as a part of their identity does not make them anything less. I'm seeing a lot online from the autistic community in particular, where they talk about it like some people don't want to say autistic person because they feel it's disrespectful, but the people that I'm seeing online are saying that for them it's a way to reclaim it as part of who they are without it defining them, without it being this big scary negative thing that detracts from who they are. It's there, and recognizing that it's there and it's a part of their experience, their life experience, because it does colour a lot of your perceptions and experiences in life. It's a way of recognizing it and validating it, but that doesn't mean it's a bad thing. A lot of people, for example, Greta Thunberg, I don't know if that's how you say her name properly, she recently said that she's autistic and she doesn't view it as a disability, she thinks it's a superpower. And so for her to reclaim it is to recognise that in her life it's a positive thing. And the people, sorry, my cat, the people who like identity first language tend to be more of the opinion that it doesn't make you less of a person, it doesn't make you less valid, it doesn't make you less competent, it doesn't make you less valuable or valued to take it on as a descriptor. Saying that I personally am a tall brunette white woman, all of these things go before the word woman or before the word person, but that they don't change and make who I am negative. They're not negative or positive. I mean, maybe some of the descriptors could be debatable. Being tall can be a little bit inconvenient for me at times. But that doesn't mean it's naturally a bad thing. And that's what the perspective is with people who use autistic person, deaf person, blind person. So what should you use? Well, it depends on whether you're the disabled person or not. generally speaking, I will always say, if you are talking to a disabled person about their experience, you should use what they want you to use. You should use what they use about themselves. So if this person introduces you and says, "Hi, I'm Natalie and I'm dyslexic. I'm John and I'm autistic," then use that wording. They say dyslexic person, okay, then copy them, because that's the most respectful thing to do. You're recognizing their experience of that diagnostic label. Okay, always use what the person you're talking about wants you to use. Okay, but what if you don't know what they want you to use? Well, that's when your judgment comes into it. I personally prefer to use identity first, due to first, second hand, third hand experiences of disability related issues. I personally have experienced depression in my life, I've experienced anxiety in my life, and so for me I would say I am depressed, I'm a depressed person, or I was a depressed person, or whatever. I wouldn't say person with depression, because it's not my perspective on person first is that when you put person and then you put the disability somewhere else in the sentence, you're distancing yourself from the disability, whatever it is. It's like you're trying to separate the two things. And for me, it's inseparable. My experience of depression has been many years. And so for me, like, I can't work out in my head when I look back at my memories, well, was I depressed at that time, at that age? In that experience, was I depressed? I don't know. I can't separate out my experiences from my depressed experiences. It just doesn't work. So to me, person first language doesn't really work, because you can't separate out the two. My experiences were what they were, and they were coloured by depression or they weren't. But that's it. And to me, the idea that to separate them in the sentence is the idea that you can separate them in life. Like you've got a whole and a perfect and a healthy person somewhere in the middle, and then around the outside they've got this extra layer of disability, whatever it is. And if you can just free them from that extra layer, from that prison, then you can take the disability away. And I don't agree with that view at all. I really reject that view. I don't think that you can take disability off like it's a backpack. There are some disabilities where, with the right treatment and the right support, absolutely you can. Dyslexic, right? So with the right supports in a classroom, I could do probably comparably to the other people in the class, right? The other students. In university, I should probably have got an extra time on my exams because of the time that being dyslexic takes from you, and having to take a lot longer to process things and to read things and so on and so on, and so those supports would help. But that doesn't mean that they're taking the disability away. That means that they're putting a plaster on a cut. The cut is still there. The plaster, or the band-aid as they say in America, is to help, not to remove the cut in the first place. And most supports don't do that. Okay, so with depression, yeah, you can get medicine, you can get SSRIs, you can get drugs and stuff from your doctor that will help you to get rid of the symptoms, and you can go to therapy, and you can go to a counsellor or a psychiatrist, and that will help you to eventually recover. That doesn't mean that you can separate yourself from disability in the same way for all disabilities. Depression is treatable. Some people the treatment just doesn't work for, so to say that it's separable is just doesn't fit my experience or what I've seen in the lives of my family, my friends, the people I know, the reading that I've done on depression, like the research and stuff. It just doesn't fit what I know at all. I really just, person first to me just sounds like you've got the child and you've got their disability, say autism, and it's like a backpack, and if you just find the right treatment, they can take the backpack off and they'll be just a child. They won't be autistic anymore. And that is just not true. It's just not true. You know, many disabilities, they're in here. And I don't mean that it's not real. I mean, it's the brain, right? You can't change the brain overnight, if at all. You know, there are changes that you can make to help someone. You can change the way you think. Practice makes perfect, and there's a concept called neural plasticity, which means that practice really can make perfect. Your brain will mold to what you need it for, to some extent. It doesn't mean that you can completely get rid of a brain difference. So for me, person first just doesn't work, but I know that there's a lot of people who really don't like the idea of saying to somebody else, you are an autistic person, you are a disabled person, because that feels so personal and they think it's disrespectful. And I say, well, the disrespectful thing is to not listen to how that person wants to be talked about. So ask them how they want to be talked about and go from there. If they're a kid, if they don't have the mental capacity to really talk about it in a very intelligent way, you know, they don't know how they want to be referred to, you have to use your judgment there, and that's where you form your own opinion. I've expressed my opinion, but I don't think that there's necessarily a right answer, because opinions are opinions, and there is something to be said for person first, there's something to be said for identity first. So you've got to make your own decision, but above your own decision and your own opinion is always going to be, number one importance is the person that you're speaking about and speaking to and talking about their experiences. That should always be number one. If you actually care about being respectful and valuing other people, you should obviously think about what they want. So that has been a very long video about person first and identity first. I hope this has been useful. I hope that if there's anything that you think I've missed, or any key arguments about these two approaches to language, that you'll let me know in the comments. And if there's another way to talk about disability, please let me know. I'd be really interested to hear it and to really dig into it. I can make more videos about this topic on a more English language grammatical level if you want, that really digs into the concepts and beliefs behind this. Let me know if that's something you're interested. But that's all for today. Thanks. Bye.